Let me borrow the words of Miss Muriel Ruykeser. The universe is made of stories, not of atoms. Today, I'm going to give you a story. This is the story of Saving Private Leonard Bergonia. It's not Saving Private Ryan. Why private? Because he was operated on as a private patient in the Armed Forces of the Philippines Medical Center. Years ago, a teenage boy was living a normal life. 2 years ago, John was brought to a dentist because of a small lesion on the lower jaw. And the dentist did a curettage of this lesion. Months later, the lesion grew big. And they went to a hospital, a government hospital, and it was biopsied. And the result showed ameloblastoma. It's a benign tumor that grows in the jaw. In this case, it's a big ameloblastoma. And they suggested resection of the tumor and reconstruction of the mandible. Because of the pandemic, they went home. But the tumor kept on growing, so they went to another hospital, and the suggestion was the same. And they were quoted a big chunk of money, which will be used in the surgery and for the use of the mandibular reconstruction plate. The parents sold their house. To make the long story short, they did a resection of the tumor, and they have to do an immediate reconstruction of the mandible using a small bone from the leg together with this soft tissue and the skin. So they transpose it, simulated the mandible by cutting the bone in segments, then putting it together on a mandibular plate. It's fixed with screws, and then connected the artery and the vein from the leg, which was cut. After a few days, they found out that the flap did not survive. So another surgery was done to remove the dead tissue, mainly the skin and the soft tissue, along with some of the bone. He ended up having a big defect in the lower lip, the oral lining, and then the mandibular plate popped out, and there was extrusion of the mandibular reconstruction plate. So from April, before I did the surgery, he was on a nasogastric feeding tube, and he lost a lot of weight, 17 kilos. And as you can see, he's so devastated, as if he had no more reason to live. He cannot go out, he cannot eat, he cannot speak because the tongue was badly scarred, and he cannot study, he cannot get married. So practically he's alive, but dead inside. I'd like to tell you the importance of the Friends Who Care in these missions. One of the founders of the Friends Who Care, Dr. Jobert Vasquez, called me up. And he told me about the story of John. I was touched, just like him. And I said, let's do our best. Because I anticipated that this case is so tough, I approached the help of Dr. Edita Gascon. She is one of the dedicated volunteers of the Hospital on Wheels. She is the past head of the Department of Surgery of the Armed Forces Medical Center. To make the long story short, despite being a civilian patient, he was admitted at the Armed Forces Medical Center. And yesterday, we were able to reconstruct the lower lip of Private John. We were also able to release the contracted tongue, reconstruct the floor of the tongue, reconstruct the oral lining of the whole lower lip, reposition the lower lip and the submental area. We use 2 flaps. Usually we use only 1 flap, the deltopectoral flap. But in this case, because the defect is big, we use 2 flaps and cover the raw area on the chest using skin graft taken from the thigh on both sides. That's how big is the defect. And we're glad to say that together with Friends Who Care and the Armed Forces Medical Center, we were able to save Private John Bergonia. I'd like to emphasize to you how important is your help. Today, you have been instrumental in saving one life. We hope that you will continue to be part of this noble project. Thank you very much. Together, we can save lives.